Welcome to Chamber Chat on the Street. I'm Dr. Vail Garvin, President and CEO of the Centralplex Chamber of Commerce. We are honored today to kick off a healthcare mini-series, and today's honored person is Jim Brexler, President and CEO of Doylestown Health, a good friend. And Jim, welcome. I just want to say thank you to you, to all of your employees, for the dedicated commitment to saving our lives during this horrible pandemic. Talk to us, please,
Vail,
about all that you're doing.
Vail, thank you for the opportunity to visit here and to do this chamber chat. And thank you for honoring the incredible heroes that we have throughout the Doylestown Health System, whether they're in the hospital or they're in the physician practices or in our nursing home at Pine Run or in the community home care. Our folks have continued to provide care throughout this whole challenge time, as they have for years and years. But a pandemic doesn't stop us in delivering the care. So and they are truly the heroes. So we're excited to be here. Yeah.
Talk to us, if you will, about the big issue that everybody has in their hearts and their minds: vaccinations.
Jeez. Yeah, no, absolutely, and it is the topic, clearly a key topic of the day. We've taken, as you would expect, a strong leadership role in the issue of vaccine distribution as it's played out. I will start, though, with the first comment, and that is that the adequacy of vaccine supply is a challenge to everyone. That's created one of the biggest issues, and it's also created confusion on who gets it and when, because there's a criteria that the state has set following CDC guidelines as to who gets the vaccine first. So
can you talk a little bit about those criteria so that our business community can understand that a little better?
Sure. So we're following those guidelines, and we have for some time as we started this process to make sure that the 1A category, 1A is healthcare workers, it's essential EMS personnel, and those are the categories that were first up to get the vaccine, so that you got people established who are the caregivers, basically the first responders through EMS. What has recently happened in the last couple of weeks is the state added 65 and over and 16 and over with medical complications to the 1A category. They were in 1B. And 1B is another large group of population of fire department and police department and school teachers and other essential workers in our community, and originally had this group in that 1B category. We were getting ready to move into the 1B category. We had done a great job of getting our workers at the hospital and throughout the health system vaccinated. We were extended out. We worked in a 6 zip code area to get not only the physician practices, but also all of the unaffiliated physician practices, other providers like therapists and others. We went to all of the EMS groups. We went to started with police and fire. We as of the time of this taping, we will have administered 11,500 vaccine administrations, which is huge, and we've done the most actually in Bucks County, so we've been very successful at that. The key to our success, though, is that we are making sure that everyone is registered before they come. It's not a walk-in clinic process. We have all the data that's required for a patient when they come in, and then we have reporting responsibilities on the vaccine up to the state.
I didn't know that.
And that's one of the reasons why this data collection process is so important. It's also one of the reasons why we've taken the first pass at getting to others in this community, patients who are inside the Doylestown Health Integrated Network, only because we have access to the medical records, and then we let our physicians prioritize the most at-risk patients as they come in to get their vaccine as we work our way down the path. But when that large group was added, which we want to get as many people vaccinated as possible, it threw 10 times more population than there is
Right.
vaccine
Like
to
a
do.
third of Bucks County,
So-
from what I understand.
So
Dr.
we're,
Dansker
so
mentioned.
everyone's working diligently. We also are in collaboration with what's called BCHIP. You're familiar with
Right.
that, but all the Bucks County hospitals and the county health department, we coordinate and collaborate on what we're doing. But Vail, also got to tell you that for big public health vaccination, the hospitals are not can't be the only place, and certainly it shouldn't
Right.
be the centerpiece. We can target populations. We can go at the people that are at risk. We can do our role, and we want to do that very diligently. But as this rolls further, it'll be through drugstores. It'll be through the county is talking about opening up their clinics. But all of us are at the behest of getting vaccine, and that's coordinated at the state level. And the state controls the priorities of when we're allowed to vaccinate to another population base. So we're very careful to follow those rules, but we are as blowing and going as we can on that issue, and we're very proud of that. We have multiple clinics that we're operating. And the nursing home population was also in the 1A category. I forgot that. And so we've been going out into the nursing homes and getting those folks vaccinated as well. We got all the school nurses and the nurses in the community vaccinated in our area. So we've taken segments and moved forward as best we can. We can vaccinate up to 600 to 700 people a day.
Really?
In our processes,
That's
where it's
impressive.
very efficient.
Yeah.
But again, it is a week by week application and allocation of vaccine that makes the difference. We were early on to administer the Pfizer vaccine because we had the large storage, supercooling capacity that we could receive that vaccine and used it. And now we're also using Moderna as well. So we're doing a lot in that regard. And I just ask everyone to be patient. There's lots of sign-ups for people about, like, where am I going to sign up to get my vaccine? I can tell everyone that if you have a physician inside the Doylestown Health Network, you are already signed up. Because you're in the practices.
That's good to know.
That means you're there, and the physician offices are in the process of letting us know who they would like to get vaccinated as they prioritize their patients on a risk basis to get the highest risk patients, as you can imagine, vaccinated, and then roll ourselves through that. But there are other avenues to do that. The county has a sign-up list as well. And then I just had to say it's confusing because each county is doing slightly different things because the state has not been clear as to what its expectations are in different areas. So
and people are driving to different places thinking they're going to get immunizations.
So I think that is, unless there is an absolute need that you have to do that, if people can just be patient and let the vaccine process work itself out. I'm very encouraged that with the new administration that maybe there is at the federal level that there's a push from that administration to put even more vaccines out and get them the resources necessary to distribute those vaccines. That'll be really important, and so we're all looking forward to that moment.
And Jim, the second important point I think is that Doylestown Health has enough vaccine to give the second shot.
Right.
And that, I think, is critically important. Dr. Dansker was saying that sometimes that second shot is not available for maybe a couple weeks after when the person should get it.
So that's another piece of information that is a little confusing to folks. There's an ideal prescripted time, 21 days and 28 days after the initial vaccine, depending on which Pfizer or Moderna. But it can be given several weeks after that as well, and still be effective.
Okay.
Yes, so that's
important.
That's the earliest that it can be given, and we've been working to that schedule. To date, we've had no problem having a second dose available for everyone that's got the first dose.
That's impressive.
And we're hoping that will continue to be the case as we apply and make sure that the state knows our plan. But we have to submit to the state the plan, the group of patients we're going to be administering the vaccine to, and then they determine how much vaccine we get. And that's true for all of my colleagues in in the community along with the county as well. So we're excited about that expansion. But that's one dimension of the work that we're doing. And we didn't, I didn't have a department of vaccinations going on here. So those are all repurposed folks from other areas that we've dedicated resources to the community to do this vaccination process. This week we had 17 to 18 vaccinators on 2 sites, plus registrars, plus the process. So we're committing full on all the resources we can to try to get this done. At the same time, we're still treating COVID patients.
I was going to ask you about COVID and then your regular general population, your elective surgeries, your elective care.
So the first wave of COVID, which occurred in March, April, during that period of time, we were forced, the state required, but we chose also to shut down all hospital services. We had no idea what the demand would be, how big the surge would be. If you're watching the reports coming out of New York and New Jersey, hospitals were overwhelmed. And so we wanted to make sure all our resources were available to meet this pandemic in the spring. And we did that, and we achieved that. We laid no one off. We kept all our associates on, even though we closed services, and repurposed people to make sure that we had adequate resources available for the pandemic. New jobs like screeners at the door and transporters, because all our volunteers had to go home. So we rearranged the deck. People did different jobs, but we kept everyone on staff so that when the pandemic wave ended and we could open back up, we had everyone here to open our services back up. And so in June, May, June, when we were able to open back up, we within a couple of weeks were back to full service. Today, all our services are opening. An interesting little point, Vail, that in the first 9 months, we treated, hospitalized about 250 COVID patients who would have lengths of stay up to 2 weeks many weeks in play. But many times they were here for a week or more just waiting on the test results to come back. We now have in-house rapid testing, so we know within 15 minutes. And then at the same time, we're able to manage in some new ways that we didn't have all those resources and knowledge. The science wasn't there when the first wave occurred. So in the first 9 months, we treated about 250 patients. Just in the last 3 months, we've treated 350 inpatients, but had a lower census, and we're able to do it all and keep the whole hospital open for all services at the same time. So, and there's all kinds of techniques that we've got going on. When you come to our campus today, you'll see this MASH tent set up.
I saw them outside.
Yeah. So that MASH tent is being used to deliver monoclonal antibody infusions, and we've done about 300 of those. And of those infusions, which are patients early in the disease that our physicians identify or came into the ER that we believe could benefit by that, they receive the infusion. And of all those patients, only 4% ended up needing to be hospitalized. The rest were able to keep from becoming hospitalized. And that's just one of multiple techniques. I have the greatest group of docs and techs and science-driven clinicians here that are so wonderful in terms of the work that we're doing, and we're staying at the forefront of that. So all our services are open. That's a big thing. Doylestown Health treats all diseases, not just COVID. That's part of our job. And we've been glad to get back into that business and doing that work. And what I want everyone to also know is that we've changed some protocols to make sure that it's safe, that we keep social distancing in play, that we have, even today, you and I are speaking, but we're distanced apart, and we will put masks. We had masks on when we got here. We're only taking them off to have this conversation. So that we keep everyone safe. Masks, wash hands, social distance. And we've put protocols in all of our departments where people are coming into the hospital to also assure safety for folks to come in. And I want to encourage people with disease issues, with chronic disease and problems, to not delay their care. Because as you know from your experience too, delays only become greater complications later. So the earlier we can get in to help folks and do the things we're doing, that's far better for the patient, far better for everyone. we're excited to say that we just in the last 2 weeks were able to change our visitation policy, so now one person
Is
can
that
still
right?
come in
Oh, that's
with folks.
that's
That was
awesome.
another challenge that everybody had, but now knowing that there's somebody that can come in with you for a procedure or for or if you're hospitalized, that you can have one visitor come in. I think that will hopefully that'll give folks a little more sense of
Right.
comfort that they can come in to get their care.
That's great. Jim, I understand you've got this great new building program underway, 100 million, and you're, what, 3/4 of the way there already? That's impressive, Jim. What all's going on the campus?
So a lot of things have been going on. One thing COVID did not stop is healthcare construction. That was an essential service continuing. Just before COVID hit, we had the grand opening of our new cardiovascular and critical care building.
That's an impressive unit.
And so that opened up with 28 new universal beds for our heart patients. Fortunately, that opened because had we not had that additional bed capacity, we would not have been able to manage the surge. So it was great to have that open and use those services. During this period of time, the third floor of that, which is a new critical care wing, is also been under construction. That will open in April of this year. So we're excited
We'll
to
be
get
there
that
with
online.
ribbon if you need
Another-
the cut.
another 32 universal beds on that floor.
Is that right? 32.
We have the part of the comprehensive renovation and construction program included new pre and post procedure areas for our cath patients and recovery area. That's all opened up now. Our outpatient rehabilitation program has moved from inside the hospital to the ground floor of a new ambulatory services building,
That's
which is
a
right on the
beautiful
front of the
building.
campus. That building will house all of our PT and OT and outpatient services. It'll also house pre-admission testing for folks that need to come in for procedures, so you won't have to come all the way into the hospital to get that. And the third floor of that building is our new outpatient surgery center that opened up just recently and started doing surgery in December of this year. And they're starting to work. A component of that program includes what's called stay suites. It's a small little
New terminology.
new term. It's not a hospital bed. You have your outpatient surgery, but if it's complex and has some challenges as you go home for your rehab, you can go into this little stay suite, stay there for a night or two, start your rehab there on an outpatient basis.
Is there nursing in
There'll
the stay
be
suite?
oversight to that, so
Okay.
it really will work very nicely and get you a great start on your rehabilitation as you go home. And then the rest of the second floor will have physician offices of the 2 orthopedic groups that are part of the Doylestown Health System. So we're excited about that building coming online.
Wow.
In addition to that, Vail, for the folks who have come on, you've seen a crane on the front of the hospital. So we're going through a comprehensive renovation of all of our surgical suites on the hospital, inside the hospital. The first phase of that was to expand the amount of square footage we had. So there's a big box being built on the roof between the emergency department and the hospital. That's right attached to all of our surgery suites. We'll open that up, extend in, build 2 new ORs, and then go 2 at a time and start to renovate our ORs throughout a several-year process of that work. And then if that wasn't enough, Vail, we have our plans pretty much complete, and we'll begin, and we're doing the fundraising now to relocate our Women's Diagnostic Center to a new location. For anyone who's had that service here,
Been there.
you know it's a little crowded in there, so we're going to give them an expanded space inside the building, which we're very excited about. And then we've got a variety of other things that are going as well. So our One Vision campaign, which you were referencing, our capital campaign, which was a 5-year campaign, started a couple of years ago, was launched with a $75 million goal. We are now at $70 million toward that goal, and the campaign committee recommended that we move the goal to $100 million. And so our board just announced that just this last week. So
knowing you and your team here, you'll reach it.
And
I'm excited for you.
Well, thank you, Vail. And I can I want to assure
Truly.
everyone that all of those dollars are being pumped right back into services to keep folks at home that don't need to be traveling outside of the area, can stay near their families, can get their care. We still are one of the 50 best cardiac hospitals in the entire country, the only one rated that way in the 3-state area around us. We're the highest rated for that. We're one of the best in Newsweek and U.S. News and World Report rated. So all of our services are at the top of the list because that's the quality that we expect here, and continue to deliver on as we move forward. And I'm just very proud of the team and the folks that are here. And most importantly, I got to say, Vail, the Village Improvement Association, who started our organization
Right.
97 years ago in 2023, well, 98.
That'll be
In
your 100th.
2023 is our 100th anniversary. It's an interesting little side note that they started this hospital during the Spanish flu pandemic. And here we are, almost 100 years later,
interesting.
back here,
Yeah,
delivering
during
to
a
this
pandemic.
community, responding to yet again another major pandemic. So,
Well, thank you so much. Jim, I also want to say thank you to you, to the whole team, for their unwavering commitment to this community, to your unwavering commitment to this community. I also want to congratulate you as Vice President of the Hospital Association of Pennsylvania. And you'll be moving into that top spot a year from now, as I understand it.
thanks,
So,
Vail. We're very
Thank
excited.
you for taking the time to do this chamber chat. We will see you again in another series of Chamber Chat on the Street.
Let's put our masks back on.
Here we go.